Hi, I'm Dr. Mike Milligan. I'm here with Dr. Susan Maples of Lansing, Michigan. Now, we're at a dental meeting here, and there were 15 speakers yesterday, and my 6 staff that are here came to me and said the best speaker all day was Susan Maples. So I want to bring Susan Maples to you. She has so much to offer, and she was named by Dentistry Today as one of the top 25 women in dentistry. My staff concurs. We're going to learn a lot from Susan Maples today. Thank you so much for being with us, Susan.
Thanks. Excited to be here.
So you're a general dentist, and you've got a large practice, and you've developed some things. Such a great concern for the patients and the children in the community. Tell us about what you've done for your community and for your patients.
Well, I've had an advantage of working with a really dedicated team, and we together have decidedly built a practice around our values, which is enhancing health relationships with patients. So we've really reached out to our community to brand the practice around facilitating health change behavior and lifting the health of our community in a number of ways.
Tell us about some of those ways.
Well, one of the ways is that we built a children's science hands-on learning lab in our office out of an old x-ray room, actually. And we've shifted from traditional prophy, which is polishing of teeth, which we know doesn't carry the efficacy that it used to. So we've shifted to the self-prophy model, and so we have a hands-on mentored approach to development of kids' oral hygiene skills.
Wonderful.
And then we do hands-on science experiments with the kids related to whole health, since we're working with affronting obesity, diabetes, and caries in kids primarily.
You're really helping these kids learn and then implement the things that will take them through their lives in a much healthier state.
Exactly.
Incredible.
Yep, we're excited about it. It's really been neat to see, because kids, when they see something or read it or hear about it, it's different from when they put their hands on it and have just a kinesthetic feeling, or it almost leaves an indelible impression around the learning. So when you ask them 6 months later, what do you remember from last time, they can tell you exactly what they did, and really kind of seals it. It's really
kind
been
of the
fun.
old dental see one, do one, teach one.
Exactly.
Well, they can see it, but you're having them do it, so then they can help themselves, probably also then bring that message to other kids.
And
teach one.
Actually kind of go home and bring it to their families.
Sure.
We're sort of skipping the generation that maybe caused some of the issues with the obesity. We're kind of going past mom and dad and saying they might be a little stuck in their habits of how they grocery shop or what they're doing at home, but kids don't want to be overweight and unenergized and unhealthy. They don't want cavities. So they're excited to learn new things.
And she's going to be able to tell us how we can help that in our community. But let's talk about something else. What else are you doing?
Well, we've reached out to close the gap between physicians and dentists in our understanding of sleep apnea, esophageal reflux, periodontal disease as it relates to systemic disease, and caries as it relates to dry mouth from the medications that are being prescribed.
That's a lot.
It is. So we're speaking to physicians, but more than that, we're writing letters to our patients' physicians when we diagnose, and then we're offering them a screening tool that they can help other patients with in those areas. So we've blanketed about 350 physicians, and now we're working with them individually and getting lots of referrals back from physicians.
And what's the tool you're using to do that?
It's called selfscreen.net, and if you go on selfscreen.net, you would actually be able to press on my name on there and see all the assessments. And at this meeting, we've made it available for the ASH members to be able to customize their own paper tablets and electronic version of that for their own.
I'm going to sign up for that.
You are?
Well, without a doubt.
It's exciting.
But so we've got those two things. Those are the two main things that we've discussed up to this point. Anything else?
We work with a concept called facilitation, and that's a big word. You might know it as co-discovery or co-diagnosis. But each year we go through our own personal training of how to be better facilitators and stay curious, stay in the question with patients, and help them come to some decisions about their own health rather than trying to impose our health behaviors on them. And I think that area is more than any tool you could do. It's how to stand away from judgment and allow people to tell their story and take a look at where they want to go, who they'd like to be health-wise, and how we can help them get there. So that's a really tender...
So this is a whole behavior...
It is.
Communication type process.
And I have team members that are committed to that. It's part of our value system. So,
any particular place that you picked all of this up?
Yes, actually, I'm glad you asked. We work with someone by the name of Terry Goss and Janice Duprate, two women, and they're amazing. They've helped us a ton. They actually have facilitation camps, so hygienists can go with other hygienists, and business team members can go with other business team members. Jackson Hole, Wyoming is where Terry is, and Janice is in Southern California.
And we can probably get more information about them from you?
Terry Goss and Associates. You can probably just Google it.
Okay, great. Before we tell them how you can help our dentist viewers here, anything else?
Oh, I'm thinking, Sherry. We have really looked at the whole area of relaxation for patients. Many of our complex patients restoratively are also complex medically, and some of them have avoided it because of fear. And a lot of patients with complex restorative needs are very, very anxious.
You bet.
So we were prescribing a lot of medications, and I didn't really like that very much. So we moved into the area of relaxation services, chairside massage services, and aromatherapy and vibration and therapeutic massage as a kind of a gating mechanism for their anxiety, which has been really nice for the practice too.
Okay. So now, how can you help us as dentists to do some of the things that you're doing? A couple of websites.
Well, you can look at mine, drsusanmaples.com, and your team members can sort of take a look at some things that we're doing. It should be pretty evident there. Go on the children's page, go on the spa services page, the relaxation services page, and take a look that way. Also, on my website, there are a bunch of articles that I've written for Healthy and Fit magazine that I write monthly for a few years, 4 years now, and you're certainly welcome to take those and put those in the hands of your patients. Also, handsonlearninglab.com. There's a separate separate website for dentists interested in having a learning lab kit and how to upstart that and implement that. That's a pretty big paradigm shift, and it's been super powerful for both referrals and helping kids get healthier.
And then the referrals from the physicians, the healthscreen.net?
Selfscreen.net.
Selfscreen.net.
To take a look at that.
So you can go to that site, and there's a way that we can implement that in our communities?
Yes, just contact our office. Let someone know you want it.
How do we contact your office?
drsusanmaples.com. You could info@drsusanmaples.com.
Okay.
And my personal email address is Suze with 4 O's, SOOOOS @comcast.net.
Okay. Now you're doing some speaking too.
I am.
So you're going to be out on the speaking circuit some, or how are you going to do that?
Well, I mean, I'd like to if people hire me.
Okay, good. So you can, so that will happen, and based on what my staff said. So probably on your website there will be a schedule of that as well.
My speaking packet is on there. The schedule isn't on there. I have 6 or 7 speaking engagements this year, but I'd like to have 20.
Okay, wonderful.
So it should be fun.
Any last things you'd like to tell us before we close here, Susan?
I just would say, you know, as a passionate person around marketing a practice for a target that serves you, both in terms of your enjoyability, your predictability, and your profitability, you know, be willing to take a look at the patients in your practice that you value most, and stay curious with them about what you can do to help them more. They have many answers for us.
Absolutely, just listen.
Yep.
Susan, thank you so much for
Thank you.
for being with us here today.
Thank you.